Okay, so with that, I will hand it over to our students who are going to introduce themselves, share a little bit about their background, why they chose a PhD program, why Penn, their research interests, and anything else they'd like to share. And then we'll get into our panel portion. So Molly, why don't you start us off?
Great. Hi, everyone. Thanks so much for joining us. I'm Molly McHugh. I'm a second year pre-doc. So a little bit about me. I'm originally from the Chicago area. I came out to Philly to actually do my BSN at Penn. Ended up going and working in a surgical ICU in DC for a couple of years. At the start of 2020, I made the right decision to go into travel nursing. So that's been an interesting year. I actually did my first semester virtually and then have come back to Philly at the beginning of this year. What made me choose Penn? I was really interested in one of the research centers, the New Cortland Center, which I am a member of, in the specific research that my advisors are doing. I also obviously had some familiarity with Penn, so I was excited to come back. I do love the Philadelphia area. The research that I'm doing right now has to do with caregiving and community-based palliative care. And I've been very lucky to be able to participate in different projects with my mentors, even virtually, beginning of my first year, which I found was like a really big plus for coming here.
Thank you. Okay, Austin.
Hi, everyone. My name is Austin Mattis. I'm a third year PhD student, pre-doc student at Penn Nursing. I am from the North Jersey area, so I saw there was a bunch of Jersey people in here, so I'm with you. I actually came to Penn Nursing after getting my bachelor's degree. I got my bachelor's up in Boston. I was at Boston College, and I was really kind of veered into the more research oriented side of nursing just in those undergraduate years. I had some mentors that I was really close with, and they were primarily involved in research activities, so they like took me under their wing, and that kind of became the niche that I carved out for myself in nursing. You know, it's such a broad field, there's so much you can do, and I really had no idea about the research side of things or how prolific some nurse scientists really are, until I had these mentors introduce me to the process. And since then, you know, with Penn Nursing, I had one of my mentors had gone to Penn Nursing for their PhD, and it was just kind of like a no-brainer. It felt like when you think about it, like all the resources and the reputation and the people here that are doing work, you really get to work with some of like the most prolific people doing the, you know, big research projects with lots of funding. And so I really got to, you know, get involved in that when I came here from my my faculty mentors that let me work as either a research assistant or do some secondary analyses on their data. And, you know, I guess that's kind of my story.
Thank you. Okay, Bruno.
Sounds great. Hi, everyone. I'm so glad to see that many of you are interested in applying for Penn Nursing. That is a very smart decision. So I'll talk a little bit about myself, my background. I am originally from Brazil. So I'm an international student currently here living in the United States. I got my bachelor's in Brazil, came to the process. So got my bachelor's in Brazil, worked for 6 months in like a emergency and trauma nursing residency program in Brazil, which was pretty intensive. But, you know, as I applied for that program, I knew that I wanted to come and pursue my graduate studies. So I had already applied for graduate school. Came to the US for my master's degree at Penn State University. So completed my master's and then came to Penn Nursing in 2018 for my PhD. This is currently my 4th year. I'm working on my dissertation right now, which has been lots of fun and lots of work. What else do I want to share about me? The reason that I applied for Penn, right? I wanted a place that like I would be able to conduct the type of research that I was interested in conducting. If any of you is interested on sleep, Penn has a huge sleep community across School of Nursing and School of Medicine. So that was for me as well, like I think just made sense for me to apply here. Of course, everything else, the reputation, location, access to, you know, so many like you have you have the hospital system, you have the VA here, right? So there are like access to patient populations that I'll be able to recruit for my potential studies. So that was part of my decision. Even I guess now taking a step back, thinking about like, why did I pursue a PhD? As an undergraduate student back in Brazil, I was pretty involved in research, always liked it. And, I wanted to be able to keep doing that kind of things that I was doing back then. And I early learned that if I wanted to have the skills to conduct research, I would need to pursue a PhD degree. So I kind of had that in the back of my mind since then, that like, that's what I wanted for my life. And yeah, and here I am. Let's see what else that I had to noted in terms of questions. I'm sure that yeah, and then like I can speak to other things as well, like if you're interested as well, coming to Penn, opportunities for you to even live on campus as well later, because that's been my experience. I lived on campus for 2.5 years as a graduate student, worked in one of the dorms pretty much. So that's something you can ask me as well. Yeah, but I'll stop right here. Oh, by the way, my research, if you're interested. So just so my research focused on sleep and chronic pain symptom management. So I work with veterans, military veterans that have a specific sleep disorder called obstructive sleep apnea, and who also have chronic pain. So I'm currently recruiting from the VA. So that's a little bit about myself. Nice meeting you all.
Thank you. And last but certainly not least, Raven.
Thank you. Hi, everyone. So my name is Raven. I'm a second year PhD student. I actually started in the program with Molly during the pandemic. But just a little background information. So I got my first degree in African American Studies and Health Disparities. And then I went and did a second degree in nursing at Duke University in North Carolina. And then I worked for about 2.5 years as a peds cardiac ICU nurse. And I was doing a lot. I was working as like a peds clinical instructor. I was working in a home health unit. I got bored after like my 3 days of work. I was like, I need to find other things to do. So doing all that stuff, I realized, like I kind of wanted to get back into African American studies and like history, because that's where like my first passion was. So I literally just Googled like nursing history, and then the Barbara Bates Center for the History of Nursing, which is here at UPenn. I saw that they had like a center here and a whole program. So I was like, well, that's what I'm going to do. And I applied for the PhD program here, primarily because they have a whole center for the study of history of nursing. So I was like, perfect fit. So I was accepted. I moved here from North Carolina 2020 during the pandemic. So my first year was all virtual. Second year, we're now hybrid. So half virtual, half in person. My research right now, I'm looking at the history of Black nurses. Specifically, I'm looking at Black nurses in the Black Women's Club movement. So that's like 1890 to 1920, and seeing how that influences some of our, models of care, and see how we can use things that they did in the past to influence how we create, like new health systems and address some of our health disparities. Also, I'm still trying to figure it out, which is what the PhD program is all about. But yeah, and I can answer any other questions. I live off campus. I actually have a roommate who's also in the program. And yeah.
Hey, thank you, Raven, and thank you, everyone. So if our attendees want to start typing questions into the chat box, we can move into the Q&A portion. And I'll start with a common question for everyone. People always want to know about schedules, managing your schedule, what the schedule is like. So if you could talk about what it has been like when you are, taking classes, what your schedule is like, and then when you're in your more sort of dissertation phase, what that schedule has been like for those of you who are there.
I can start speaking about the dissertation stage, since you mentioned that at the end. I had this expectation that once I reached dissertation status, that it would be just, the joy of being a PhD and just, more time to read and more time to do things, because I wouldn't have classes. That's kind of the milestone, right? So in the program, you start taking your required coursework, which is a lot of time that you spend, and you can talk about that as well, what it looks like, because you're a full-time student in the program. usually. And in my mind, I was like, okay, when I'm done in my classes, it will be fine and great. I'm actually more busy than I was before, just because I'm doing primary data collection for my dissertation. So that requires a lot of me making phone calls and like runs through the VA, just to recruit participants. So I think it is busy as it was at the beginning, I think, in a sense. But you will learn, like, as you progress in the program, to manage your time better. That's something that I feel like I'm about to graduate, and I still don't feel that I have like the like under my control. Like, so it's just like I feel it's a process that you're gonna keep learning how to better manage your time and your other activities, right? Because we all, have families and we have social activities, and like achieving that balance of being able to be productive and do your schoolwork and your work, but at the same time taking care of like all these other areas of your life. It's so like it's a tricky thing that you I guess learn over time. But that's my 2 cents, and I can come back later if someone else. But.
Yeah, I'm not sure if we should continue with that question or if you want us to address like some of the questions in the chat because there's like a bunch flying in.
If you have anything else to add, you can to that first question, you can, or if not, we can go to the next question.
Well, I'll just say briefly that I guess my expectation at first, you don't know how your time's going to be split, and you think of yourself as a student going into the program. So you really think that like, oh, it's going to be like, previous experiences with school where class is the most important thing you're doing. It's where you're doing majority of your learning. And really, I think once I was in the program, I realized that, classes are just a part of the experience really, and it's part of where you do your learning. But really you have all these kind of opportunities to get involved in things, whether it be from like your mentorship side or I guess primarily through having involved mentors, you can get involved in a lot of things, and you do a lot of your learning outside of the classroom and in developing your own program of research as you progress through the program, whether it's working on papers, abstracts, working as a research assistant or teaching assistant. That takes up time as well. I saw there was a question about that and how you manage it all. And I think of it kind of as you get all these kind of things that you take on when you become a PhD student, and you get this skill of balancing each thing and shifting your mindset from what you need to focus on right now, and then okay, I have these research assistant responsibilities, so I set aside time to do those things, and so you get really good at kind of balancing responsibilities, which I think is an important practical skill that you need to have by the time you graduate. So the program really prepares you for that.
Okay, there's a question about oncology research. Are any of you I don't think any of you are involved in oncology. There are definitely faculty who are doing oncology research. Does anyone want to call or know anyone? Not to put anyone on the spot, but.
One of our Raven and I's, like a student in our cohort is doing CAR T cell therapy, which is in the like oncology sphere. But I would just encourage everyone to kind of look at the list of faculty online, and you can look at their research interests there too. So I reached out to faculty prior to completing my applications to make sure that they were completing research in the area directly relating to my area of interest. So that's a good way to just double check that it's a good fit.
And I just
Go ahead.
I put the link to where you can search for faculty research interests in the chat.
Perfect. I'll just quickly jump back to the first question, just like another, because like as you said, like that's a common question in terms of like schedule, how much time do I spend? Like, and you can look into like the PhD handbook and see like how many classes you'll be taking your first year versus your second, kind of. But just usually like in your first year, you'll be taking every semester at like 3 to 4 classes usually. And that'll be anywhere between 6 to 8 hours of classroom time. That sounds like little, kind of like what Austin was referring earlier, but just, keep in mind, like it's a very different type of structure. Like the time that you spend in the classroom is actually like the smallest part of your time that I feel that you're actually engaged with, the material and like learning. It's extremely important. But there is like all this extra time that you might feel like, oh my gosh, I have this open schedule. But then there are all these other so much reading that you're gonna have to be doing, thinking about, like you're just gonna evolve from like, hey, I'm interested in this area, to like funnel down to a question that can be answered in a project. Like this takes time, like meeting with people. If you're a TA versus not, if you're involved in a center, that also takes time. So like you can envision as like you're about to enter in a full-time job. Like think of it this way, might be a good framework to start off with. But
yeah, that's a great point. We have a question about how big are the class sizes? I know that varies, but if you can mention how big your class sizes have been and how many mentors you have.
Yeah, I think the class sizes, well, you have like your coursework, you have your required like nursing coursework classes, which will be like the people in your cohort. So I think Molly and I's cohort was pretty big. So we probably had like 11 to 13 students, but I think this incoming cohort, it's a little bit smaller. So it's about 7 to 9. I don't think it'll be more than 15 people in like your nursing cohort. But then you also get to take elective courses, which are out, they can be in the School of Nursing or they can be outside of the School of Nursing. So those can be like huge classes where it's like 50 plus students, or it could be another smaller course where it's like 10 plus people. But when you do register for your courses, you get to see what's the cap size in each course. So that can kind of let you know if it's going to be a big class or a small class. And I find that the graduate courses sometimes tend to be a little bit smaller because it's just graduate students, but some courses have undergrads and graduates, so those can be bigger. So some are big, some are small. And then the mentor to student ratio, I think when you come in, I was assigned 2 advisors. So you have about 2 to 3 advisors incoming. And then I think it's up to you how much time you kind of want to spend with them. You kind of decide with your advisor, like, what do you need as a student? Like, do you need to meet biweekly? Do you need to meet once a month? I think at minimum, you meet at least once a month. For me, that's what I wanted with my advisors. I was like, especially during the first year, I was like, let me just focus on coursework. And then we met like once a month, like what are questions? What are things that you want to talk about? Always, I think they're available by email. So if you need to meet extra, like, hey, can we meet next week? I think most advisors are responsive to that. I think another thing too, like you're designated 2 advisors, but if you know that there's someone at, like outside of the School of Nursing, you can have them technically be an unofficial advisor, like, hey, I'm interested in what you're doing. Like, can I talk with you? Like, you can develop relationships outside of your advisors and connect with faculty outside of the School of Nursing. And I think for the most part, everyone is excited. Like a PhD student, they're more than happy to talk with you and help you.
Okay, and Raven also kind of answered this question, but if anyone else had anything to add about how accessible are the faculty for the PhD students during the program?
I'll just comment and say that my experience has also been that my advisor has been extremely accessible. Like you are going to be assigned 2 mentors, and then one is going to end up becoming your primary mentor and the other person your secondary mentor. Pretty much what Raven just said. Like, so my frequency of meetings with my advisors have changed over time based on my needs, based on my availability, her availability. I started as once a month. At this point, for me, twice a month, sometimes actually every week or more than once in a week with my dissertation. Like, so like, it depends on the stage where you are, like how much you're going to need of them. Like, but my experience, like she has been really flexible. Like we've had, and it's all about like building this communication from like, the beginning, you just get to know them. It's this relationship that you build over time, right? So it's kind of like hard at first to ask like a lot, but like as you build this relationship, you get to know each other, you get to know how each other work. And then from there, you kind of, find a good pace that you're like able to meet your needs to progress through the program, but also not, being excessive, if you will. But yeah, I don't think that'll be an issue, but.
Great. So it was mentioned that the program's currently hybrid. I'm not sure if any of you know this. Have any decisions been made about how classes will be conducted next year?
I think we just received an email from the university this morning saying that we will continue in a hybrid format for next semester. That's the decision. I think that it was literally sent out this morning. So I think that's, yep.
Yeah, the school is kind of making decisions on a semester by semester basis. So we will, I think the plan is to try and to return in person as we can, but there may be some hybrid options next year.
And just to give you an idea of what like that looks like, I am in full-time classes, but doing a pretty significant amount of research projects on the side. I'm usually in person 3 or 4 days a week, and then I'll work from home like 2 days a week. All of my classes right now are in person, but there are some that are offered hybrid, although from what I'm seeing, less frequently.
And I can comment on this too, actually, because I'm someone who's doing everything entirely from home in North Jersey. And like I have one class that was like supposed to be in person, but then a bunch of people wanted to, Zoom into it. So it seems like in that case, when things are in person, at least in my experience so far, professors have been receptive to, also just having a Zoom link sent out. So you have some people that are there in the classroom while others are kind of like up on the screen. And a lot of, I don't know, I guess I've seen that, I guess there's a lot that's going on in person and virtually. And it actually feels less restrictive now even than ever. It feels more accommodating, I guess, actually, having this kind of hybrid formula where, there's opportunities to do things in person, but if you're someone who's also not available in person, there's a lot you can be involved with kind of at a distance also.
The next question, how have your research interests evolved as you've worked with your mentors and have been taking classes? Are you researching what you expected when you applied?
I think for me, I came in like, obviously I'm doing the history of nursing. So I'm still doing the history of nursing. I think I came in like, I was actually reading my application a few days ago and I'm like, what was I talking about? But I think it was kind of like, this is generally what I'm interested in. But I think throughout the program, I've been narrowing it down a little bit more to like a question, like what can be answered during your time in the PhD program in her dissertation. So I still think I'm doing what I want, like in terms of history, but like what population or what data source I'm going to use changes a little bit because I think you come in with what you're interested in, but it also depends like what data is available, like what populations do you have access to, which is what you and your advisor kind of figure out together. But I think for the most, and I think it's kind of okay to change a little bit because I think I have some classmates who came in wanting to do this. It's kind of related, but then they're like, that's not what I applied for. So I think there is room to switch a little bit.
Yeah, I think there's like actually a lot of room to move around because if you think about it, when you enter the program, you have, everyone kind of starts at different points, especially in like knowing the literature and whatnot. And over the course of like the first year, for instance, you're developing a better kind of base and thinking about things conceptually and kind of understanding the literature in your field of interest, and developing like analytical skills, methodological skills. So I guess you kind of would expect your research goals to change a little bit, or maybe your project proposed to change a little bit as you kind of pick up that knowledge and develop those skills, because now suddenly your question is informed by what you think is feasible, or maybe you identified things that you didn't think were barriers to begin with, where you can account for more things, where the gaps in the literature are better now. So you kind of take all that into account to kind of hone your question to something that's like novel, innovative, accomplishable. So I think like for me, mine changed pretty drastically, but in a good way because of that.
And I'll add from an admissions perspective, your admissions essay and your application, we're not expecting a literature review or a research paper. That's the whole point of the PhD program. We do want to see a demonstrated interest in a research phenomena, but we do understand that as you progress through the program and learn more and find out more, that your research interests may change and develop over time. But we are looking for that demonstrated interest. There's a question about transferring credits. So you can transfer up to 2 classes. That's not guaranteed, and it's only evaluated after you would be offered admission. Another question, I'm very interested in qualitative research methods. What have your experience been in finding resources and faculty who hold this interest?
I can speak to this. I'm also interested in qualitative methods. Right now, I'm working on an implementation study that's a mixed method study, and I'm doing part of the qualitative arm. So there's definitely qualitative research going on. My research residency will be qualitative. I'm a member of our Advanced Qualitative Collective student group. So that's a bunch of us that are students that are interested in qualitative research. And there are also some pretty solid classes within the university across disciplines that cover advanced qualitative methods.
Yeah, and I think everyone in my dissertation seminar class is proposing like a mixed method study, so that by nature has like a qualitative arm. So there's definitely a lot of interest in like I think at least in the cohorts, and there's definitely faculty supporting those interests. So I think it's really receptive, a really receptive environment for qualitative stuff.
Great. How supportive are the supervisors in the research process? Supportive.
Yeah, go ahead, Molly.
I would just say, I mean, my advisors are generally members of my research teams that I'm working on. It's an unusual week if I haven't met with them 3 or 4 times across all of the things that I'm working on. And a lot of times that's just a like phone call being like, did you understand what we meant by this? And they're just supporting me with some follow-up information that's not even built into our mentorship meetings. So I found it to be a very supportive atmosphere. They're always looking for ways that I can increase my participation in different projects and different experiences.
Yeah, I think my advisors are pretty supportive also. I think you have those standard meetings, like standing meetings, like, hey, let's meet. What are you up to? What are you working on? What questions do you have? How can I support you? But I think they're pretty good about like, she'll send me articles like, hey, make sure you read this. Like, this is something to look into, or like, have you heard of this? Like, very like, think about this, like, make sure you read this. But I think too, I have had classmates where their advising relationship wasn't so supportive, and there are like, I guess, things in place if that does happen of like, what if me and my advisor aren't working well together? I think there's like a grad group chair that you can go and say, hey, like we're having these issues. Of course, you can, of course, speak with your advisors. For the most part, I think they're all open, like, hey, like, what can I be doing better? Like, what issues are you having? But if it's not working for whatever reason, there's people in place that you can go to talk to about maybe switching to someone who's more supportive, or like, hey, I'm working better with this person. I think they would be a better fit for me. So there is room to change an advisor if you need to.
Do you work outside of your TA or RA position? Do any of you have nursing shifts? And how much are you able to work? I think it's 8 to 10 hours.
Yep. So basically, if you're an international student, you are allowed to work an additional 8 hours. And if you are a US citizen or resident, you are allowed to work up to 10 hours on top of your assignment. That's been the rule. People have done different types of work. Some of them will take, a shift once in a while, once a week, once a month, twice a month. I've supplemented, my, I guess, work sometimes as a research assistant for projects in a separate, assignment pretty much. I've also taught classes for the School of Nursing as a lecturer. I've been hired to teach twice for like the intro statistics class for the undergrads. So that was really nice because I also got the experience of teaching formally during the program. It's a nice CV item, and I was paid for that as well, just, for that position. So there are opportunities for you to work outside, but with these limitations in the number of hours.
Right. If you applied to other schools and were offered admission, what was the deciding factor that led you to selecting Penn?
Great, you got it.
I think I actually applied to a lot of schools. I applied to 7. So I think the deciding factors for me were my stipend. I think Penn was offering the highest stipend, like once I calculated everything. So it was the highest stipend. And then they had the center here for me. So like there were other schools where they were like nursing historians, but the fact that Penn had a whole center dedicated to this, I felt like it actually had like the infrastructure to like support me. So I think having certain centers accessible were like what led me here. Also Philadelphia, I was living in North Carolina. I knew I wanted to move to a bigger city. So I was like, Philadelphia is a good fit. Like I can go to DC, Virginia, like there was an airport here. So
Anyone else?
I guess what part of it was with me too is like I was receiving kind of information from my mentors when I was an undergrad about it. And I think Penn just like it just kind of has like a weight to it, that's like well deserved because of all the resources that they put into their school of nursing and the faculty that's here. And I just kind of had to make that comparison of like, who would I get to work with at Penn? What kind of, centers are here? Like you guys say you consider the centers, even if you're not part of a center, you have that opportunity to like connect with people in those centers or, at Penn at least. I'm really involved in research and nursing, but I'm also really involved in a few research projects over in the School of Medicine. So kind of thinking about thinking about the institution at large and what it offers. It was harder to kind of match. And then thinking about being someone from Jersey, getting to, location matters for people too. And that worked for me.
Great. Can you talk about your career goals? What do you want to do with your PhD?
Yeah, I can get started on that one since I'm looking to the next step kind of. Um, for me, I guess a couple of things come to my mind. Like I've like just a lot of introspection and thinking about like which path that I want to go because there are many possibilities. That's kind of like I want to start with. The traditional thinking says that when you go into your PhD and pursue a PhD, you then graduate and move on to work. You could get a postdoc in between, but kind of like long term is for you to go into what you call a tenure track position, right? To become a professor at an academic institution like a university. That's a path that many of our graduates have taken, many of our colleagues have applied for. That's a path that I'm pursuing now to apply for, assistant professor, tenure track type of position. But then you can also see there are like many other options as well. Like you would see, like if you participate in some of like, sometimes you have the alumni talks, people who are alumni from the PhD program who have moved into like administration, who have moved into, we have alumni who are like at the NIH working as PIs there, people who are working in the health systems as a nurse, as a health scientist, or a nurse, like the chief of nursing research of a health system, or within the VA, within like, so there are many paths that you could take. That's, yeah, my sense, what I'm about to say, but yeah. But usually people think about going into academia. That's kind of the traditional thinking. But keep in mind, there are other possibilities, plenty of them.
Do any of you have young children? Or Bruno, okay. Can you talk about your experience of doing the program while having kids?
My experience is quite recent. So my child is 6 months old. I think it's challenging in a new way, right? Like it's just when you start a program, it's challenging. Then like when you start working your dissertation, how your candidacy, that's challenging. It's all about, goes back to the point of like time management and having your priorities straight, I think from the beginning. It is, I would say it's totally doable. I feel like in a sense, it is more challenging because I have like an extra demand in a sense. But we do have like plenty of folks, and like that's kind of like how we rely on all the people that went through the program in the same situation. We have many friends and colleagues and people who have graduated who had young kids, who had kids during the program, like mid of the program, beginning of the program, end of the program. It is doable. You also have resources on campus, just to bring it up. Like there is a family center at Penn. They have small grants, for example, that you can apply for. So you can apply for grants if you have a spouse, let's say you have a partner, somebody that will be coming with you, you could apply because like as PhD, just to bring this up, PhD students, we have a health insurance paid for us. But if you have somebody with you, like a dependent, you could apply for a small grants that you could get for, health insurance for your dependents. They also have family grants that can help subsidize child care, and a couple of other resources. They would have frequent events for families to meet. And they do have like now they are remodeling, I think, the family center this semester, but it's usually like a nice place to be at. Like they have a little like children's playroom that you can go and just spend time there. So there are lots of resources for PhD students with families. That's kind of my point here. And I'll be glad, like if you have questions, you have my email at the end as well. Glad to, point you some other directions.
Great, thank you. How did you choose your research interest?
Mine was driven through my clinical experiences and then kind of refined through the program. I think Austin was mentioning kind of tailoring your research question throughout the program. And that was definitely a big piece of kind of identifying exactly which piece of palliative care in the community was important for me. But yeah, most of mine came from my clinical experiences.
Yeah, I think I think a lot of us bring these experiences that we have, the clinical, in my case, it's like a personal experience. And that just kind of like sparks the interest and gives you like the first thread to pull. And then you're kind of like, as you're in the program, you're pulling it more and more to, really develop, your knowledge of the field. And then the more the more you can question. And then that kind of spirals into, having lots of interests. And so you get this broad perspective in the program to begin, and then you slowly start focusing down. What's the first kind of question I want to attack with my my dissertation, and how will that set me up to then kind of start addressing all these other questions that I find really interesting.
And just to answer the second part of that question, should we select the mentors or does the university select them? So you should definitely identify at least one faculty member and reach out to at least one faculty member. You can certainly reach out to more, but ultimately, at least for the purposes of offering admission, the university, we will assign you mentors. And as students have explained, if your research interest changes or evolved, you could certainly change and add mentors. Another question about schedules. Do most of you have classes multiple days a week, or can it be condensed into 1 or 2 days a week?
People are usually able to condense their schedule a little. Your nursing classes at the first semester will be offered kind of like it's kind of like the days they're offered. Like, so you have to be like, my point is like, you have to go to your required nursing classes, right? And then your optional coursework that you have to take, that's also important. Then you can kind of just like try to identify courses that are offered in the same times, kind of like same day. Some people, will live in New York sometimes in the past, or like they would kind of like come and go, stay for like half of the week here and then go back home. Totally doable, I think. But it might just be limited, like sometimes like, oh, I really want to take this class, but it's only offered this time. But you can, always find like, I guess, other courses. But the short answer is yes, you can definitely condense, I think, 2 to 3 days.
Yeah, a lot of those required nursing courses, I think off the top of my head, maybe even all of them, I think they're like once a week courses. And there's like a lot of opportunity for them just kind of having things back to back, or having like a day or two that you center just for your classes. I've done that a lot.
Okay, are research achievements a major factor in determining PhD admissions? So I'll answer from the admission side. Is you do not have to have research experience. We are looking for research potential. And then I'll put it to our students, if you could talk about any prior research experience you had before the program.
I think it matters, but not as much as you think it does. So I know for me, I was a research assistant like in undergrad, but then once I was in nursing school and then like practicing as a nurse, I didn't do any research. So I think I came in saying like I'm interested in research and this is kind of the exposure that I've had and I like want to do more of it. But I also think don't discredit, I guess, some of your nursing experience that you can count as like research. Like if you did like an evidence-based project or like there was an issue on your unit, like that's technically research. Like what brought you to that question? What are the steps that you did to try to answer it? Like what team members did you work with? I think all those things can count as, like a research experience. So if you weren't like in a lab for 10 hours a week, don't worry about it. You can still apply and like that will count.
I had no research experience outside of my clinical evidence-based practice poster. So don't discount yourself if you just have a very strong interest, because I feel like I've been able to keep up with the pace of my cohort, even with my limited research background.
And I guess just to, like you would see that the cohorts are usually kind of like pretty heterogeneous in terms of like where people are at in like different things, right? Like which point in their life, how clinical experience, another one, like some people had zero clinical experience, some people had a lot of clinical experience, a lot of research experience, little research experience. So I think it's really about, as what Jamie mentioned, in terms of research potential. So don't feel like you're at a disadvantage because X, Y, and Z. Just to bring that up, I think, but.
Sorry, Austin, did you have anything else you wanted to add?
I was gonna say that I think like it feels like when you enter the program, it's like kind of a different beast than what you may have experienced clinically, or even if you were like working as a research assistant as an undergrad, or so I think like you said, maybe it's like you want to demonstrate the potential, but it's like I think the baseline assumption is that like everyone's gonna start at this one point that's like they set the bar kind of low and they build from there. They're not assuming you know how to do anything. They're just kind of trying to cultivate that potential rather than like assuming you have all these built up, developed skills. That was all I was gonna say.
Great. Yep. All great points. And that's exactly why we don't require research experience, because there are so many other experiences that you've had that can contribute to research potential in the PhD program. Okay, this is an interesting question about reaching out to faculty. What should we say or ask for? So if you can think back to when you were applying and reaching out to faculty, how did you approach them? What did you do?
I'll jump in on this one quickly. Definitely, if you find someone that you think you have shared interests with, read some of their work, have some sort of knowledge of the stuff that they're doing, and then you could reach out to them and kind of use that work as your jumping off point. It's like, hey, I had these interests and I looked into your work and I thought this was really interesting. I thought this paper was interesting, this finding, or how you went about studying this was interesting, because I think everyone's excited to talk about their work. And at the end of the day, it's like over the course of your program, it's about building relationships with these people. That's kind of the start to building that relationship and seeing if you guys can work together well, and I think it's an awesome kind of common ground you can have is like, we both read this paper and we found that, you did it. I found it really interesting. Let's talk about it a little bit. And then you can hash things out from there.
Absolutely. I think to add to that as well, it's important, like when you reach out, like if you have a CV or resume, like send that along. Like that's helpful even for them to get to know you a little bit. Like any active outreach, like just always send your CV, introduce yourself, say the purpose of like, hey, I'm applying for the PhD program. I really like your work. Are you available to meet, like to have a short meeting with me, 30 minutes in parentheses or something like that? Like be specific, like I'm asking you to meet for this period of time. Glad to send you out like a calendar invite. Like you can suggest a couple of dates or not, or maybe just wait for them to respond if they're interested, and then you go from there. But I guess just like being explicit what you want, and don't forget your CV. I think that's helpful as well, just for them to, oh, who's this person? But
I found that these calls were really helpful for me when I was making determinations on where I wanted to end up. I was really interested in kind of some nitty-gritty questions that I integrated into a larger conversation. But like Bruno, I was pretty specific in asking for like a 30-minute conversation and sticking to that. But I was kind of interested briefly in their career trajectory, if they thought they were going to be staying at Penn. Something I was not interested in, to be honest, was matching with a faculty member that was planning on leaving or going on a leave or something like that. Because at Penn, sometimes your PhD programs can be as short as 3 years. So if I was coming to spend time with one faculty member, it was important to me that they were there. Other things were just kind of what projects they were anticipating to be working on. If they have research that is in the methodology that you're interested in, that's a plus. And then I was also just reflecting personally, if I felt like the conversation flowed easily, if I was having to like really work on a conversation, that might not be the best match for me. And that was just something that was important for me to know.
Yeah, think of it as you're like almost professionally dating these people, like because like you're gonna be spending so much time with them. Like, of course, you want to be accepted and you want them to like you, but like to some extent, you also want to like them because you're gonna spend a lot of time with these people. So, good advice, Molly.
Great. So we did talk a little bit about exploring outside of Penn nursing. So another question, how do you explore interdisciplinary connections at Penn? Do your mentors suggest connections? Do you find them yourselves? Do you have any mentors outside of Penn?
I'll say sorry, you go first, Raven.
Okay, I was just gonna say, I think it's everything that you said. Like it happens so many different ways. I think within your nursing courses, I think they do bring in guest speakers who are in other departments and other schools. So that's one way. And I mean, when these people come, like you can email them after class, like, hey, I'm interested in your work. And right there, that's a relationship. I'm in history, so like I do most of my coursework outside of the School of Nursing. So I literally go on the course catalog and I look at all the courses that they're offering at other schools. And even if I can't take the course, I know the faculty who's teaching it. So that's a way to say like, hey, I see you're teaching this course. And I just email them like, hey, I'm interested. So taking courses outside, and then I kind of do some other personal projects that I've been able to connect with people outside of like Penn. So that's another way that I've just connected. Twitter, surprisingly, like people are all over Twitter, like academics, people in PhD and research. So sometimes you'll make a tweet and someone will be like, oh my gosh, I'm so interested in that too. And then there's a relationship right there. So a lot of ways. So go ahead, Austin.
Yeah, I was just going to say kind of it reflects back on the last question too, the answer to that question about, identifying mentors. It's the same process. It can be over again. It's just like now you're in the program, but you still can look at other schools and see the faculty there and kind of do what you did the first time, but to establish, mentorship with that person, reaching out to them, wanting to set up a conversation, giving them your CV, saying, where you think your research interests overlap with theirs and, knowing what kind of work they're engaged in and how you might get involved. But I think it's like the first that you're going through right now, you'll kind of be constantly trying to do that and identify mentors to help fill your gaps as you're in the program too. And sometimes it'll be your advisor who has a friend. It's a lot of the time when you're in a field, these fields are very specific and a lot of people know each other. So say, hey, this person works with that, let me introduce or connect you to them and see, what they're working on. And maybe they can use you and you can help out with them and you can learn from them. So I've kind of had the experience of both of those.
Great. We have another question. I'm curious about research opportunities. I'm assuming outside of your dissertation. Have you been involved with research or participated? Is the atmosphere encouraging and do they support students to have various experiences? Looks like that's a yes.
Yeah.
Oh, sorry, I can go. Just briefly, I think like some of this is you choose your own adventure. There are plenty of opportunities at Penn. You might want to be a little selective about which ones you get involved in because it's your time and you want to manage that well. But I have had no difficulties in identifying any number of opportunities as long as you're also putting yourself out there and saying that you're interested in getting involved, there's definitely opportunities to do that.
So just going to cap it at these last two questions. Is it possible to name too many people as possible mentors in your application? No, but I would probably cap it at around 4. And if I see you're interested in a research center, so we can always identify other people. If any of you remember how many people you mentioned in your application, I know that was a while ago.
I would say 2 to 3 people, and like
Yeah.
just don't cite their names, like make
Mhm.
some connection. Like I'm interested in working with Dr. So and so because her work on the and person so and so due to her experience in these methods, or like recruiting from this patient population. Because if you just cite people, that's no good. Like have a connection on that. But yeah.
Yep, so that relates to this next question. Did you speak with potential faculty mentors before submitting your application? And are they your assigned mentor? Yeah. So it's important to reach out to faculty during this time. Okay, so looking at the time, I want to end with one final question for our students. Thinking back to when you were in everyone's shoes here applying to PhD programs, you have one last piece of advice as our applicants are getting ready to submit. Can you share that advice?
I'll just say one thing, like it feels like it's a lot to do right now, like paperwork and submissions and essays. I just think that's all worth. Once you accept, you're like, you'll kind of forget like, oh, was it too much? No, just easy. So like if you're in the thick of it right now, just like stick it through and just you make it. Like don't give up.
I think for me, something they always tell me, like they're always like, wow, you're very passionate, is that like let your personality speak through your application. Because I think when you submit, like everyone's submitting resumes, everyone's submitting scores, everyone has, for the most part, has some type of clinical background. So it's like you all start to look the same on paper. So it's like in your personal statement, in those essays, kind of show like, why are you interested? Like, what do you see the future for you? Why do you want to work here? Like, what did you not say already in your resume or like in your job experience? So definitely use that personal statement to like speak to the people without actually being there. And proofread everything.
Yeah, absolutely. Proofread, show that matters. But I think the kind of the big point that I think about is, from my experience, there's no ideal candidate. It's like, so be your, kind of like Raven was saying, like let yourself shine through. And if you're applying to the program, obviously you think that you're a good fit for it. Try to really emphasize why you think you're a good fit. But there's no need to make anything up or feel like you're lacking. Just accentuate your best characteristics.
I think everyone had fantastic suggestions. Might be taking like a step further, but whether or not you choose Penn, like take that summer before. Don't feel like you have to cover any bases. Enjoy, relax. There's plenty of time when you're in whichever program or wherever you end up to put a lot of time into something, but that's time for you. So be true to yourself in that section as well, outside of your applications.
Great. Well, Molly, Austin, Bruno, and Raven, thank you all so much for your candid responses and honesty. I know everyone always appreciates hearing from students, and we so appreciate you sharing your experiences and volunteering your time. As a reminder for everyone, the application deadline for 2022 enrollment is December 1st. That is coming up sooner than you think it is. So make sure you get in your application materials on time. This recording will be emailed to you in a few days. And as always, don't hesitate to reach out with any questions. Thank you all again and have a wonderful rest of your day.